Everybody. My name is Sean Phillips. I'm the Head of Health and Social Care at Policy Exchange, and it's my great pleasure to welcome you to this next event in our Fringe programme here at Policy Exchange this year. And the question that we're asking is, what role should workplaces play in tackling economic inactivity and improving health outcomes? And I'm delighted to say that we've partnered with the Health Foundation for this event today. Now, poor health is increasingly driving economic inactivity, and it's not just those of middle or more elderly age, but also just take young people, for instance. So there's nearly 800,000 16 to 24-year-olds that are not in employment, education or training, and we know it's about a quarter of those that are not in employment, training or work because of poor health. Now, the Office of National Statistics have recently noted that the sickness absence rate, that is the percentage of those percentage of working hours that are lost because of sickness or injury, has risen to a level that it last was in 2004. So the topic that we're discussing is of great economic but also political saliency. Now, the Chancellor announced £2 billion at the spring budget to support disabled people and people with health conditions to work. And we know that health outcomes ultimately are determined by a wide range of factors, not solely determined by our interaction with formal health services. So the big question we're asking here is, what role should employers and workplaces play in supporting improved health? The Department of Work and Pensions have a consultation at the moment on exactly this question around occupational health and what the future vision of that should be. And this is a really important question to engage with at this time. We know, for instance, that it's only about 45%, according to that consultation document, 45% of workers have access to occupational health services. And we know that small employers in particular are 5 times less likely to be able to provide access to OH. So it's very welcome and very timely to be having this conversation now. And indeed, to consider these questions, I'm delighted to say that we've assembled a fantastic panel. And to my right is Tom Pursglove. He is the Minister of State at the Department of Work and Pensions with responsibility for disabled people and health and work, and that's a position that he's held since October last year. He was previously Minister for Immigration at the Home Office, and he's been the MP for Corby since 2015. To his right is Jo Bibby. She's the Director of Health at the Health Foundation and is responsible for leading the Foundation's Healthy Lives strategy, which is to create the opportunities for everyone to lead a healthy life. And she joined the Foundation in 2007 and has been influential in developing their portfolio of work there. I'm hopeful that Jill Rutter, from who's the Head of Programme and Policy at the Learning and Work Institute, will join us shortly, and I'll maybe introduce her once she arrives. To my left is Chris Smythe, who is the Whitehall editor at the Times, and that's a position that he has had since September 2019. And then on my left is Alex Veitch, who is the Director of Policy and Public Affairs at the British Chambers of Commerce, and that's a position he's been in since March last year, and he's responsible for the policy position developed by the Chambers network and its Business Insight programme. So in terms of the running of the session, I'll hand over to each of our speakers, beginning with the Minister in a moment. They're going to deliver up to 5 minutes of opening remarks. Then we'll pick up maybe some of the overlapping themes and comments that our panellists reference, and then it's over to you for the final 15 to 20 minutes for question and answers, and our only house rule is that you state your name and organisation when the microphone is handed to you. So without further ado, Minister, delighted to hear what you have to say.
Well, thank you, Sean, and can I firstly just start by saying thank you to Policy Exchange and the Health Foundation for putting on this really important event on an area that all of us here I know are really interested in, but also it's an agenda that is becoming more and more prevalent in a lot of the media reporting and also of interest to people up and down the country. What do we know? Well, as you touched on, when it comes to occupational health, we know that the availability ranges very considerably from business type to business type. So when you look at large firms, there's around a 92, 93% availability, down to 17 or 18% when it comes to small and medium-sized enterprises. We know from our research, and we set this out a little bit too in the ongoing consultations, that a lot of the challenge often relates to knowing what good looks like, and we need to put some real emphasis behind establishing what good looks like and benchmarking around that, and then trying to cascade that mark of good. And we also know more generally, and this is the sort of thrust of the structural reforms that I'm seeking to take forward as the Minister for Disabled People in the DWP, that 1 in 5 disabled people would like to try work and would do so with the right support. And the challenge that we are talking about today, I am very clear-sighted, is not one that government can solve alone. These are challenges that we can only work through constructively on a partnership basis. Government alone cannot intervene to deal with all of these challenges. We've got to do this in a joined-up way, taking people with us on the journey. And that occupational health consultation that is ongoing focuses on what best practice looks like, how we share that best practice, what we can do to try and consolidate guidance, defining a clearer baseline for what good looks like, potentially looking at new voluntary standards with accreditation around that, and greater government support to help employers to be able to work towards those standards and go on to achieve them. And I think when you look at the work that we've done around disability confident in recent years, there are already some established ways of working that I think lend themselves to being adaptable, and some lessons that we can learn from that. That has been hugely effective, getting over 18,000 employers signed up as being disability confident employers, but we need to take that to the next level now. We need to evolve that, and one of the great advantages of the National Disability Strategy no longer being on pause is that we can get on and do the review of disability confident, which is something that I am very keen to take forward. And I think we ought to be looking at this retention piece as we take that work forward, along with deepening that commitment to see people really commit and provide meaningful work opportunities for disabled people and people with health conditions. And more generally, there is a big amount of work going on across government. In fact, I think it's fair to say that I can't remember a time since I've been in the House of Commons since 2015 that we've seen quite as much government join up around this agenda, with the direction very much being set by the Prime Minister, the Chancellor, my Secretary of State in the DWP, Mel Stride, as well as the Secretary of State for Health, recognising that we can do better in this area and that we can unlock that potential and support more people to retain their roles and to succeed and progress within them. And any changes that we make to occupational health, I couldn't be clearer, it needs to fit within that wider landscape of support that we're putting in place. And people here in this room and beyond, we would certainly welcome your feedback as that consultation draws to a close, to make sure that we are hearing what works, what people think we need, and what we ought to be concentrating on to help us build a better understanding of the evidence base, but also making sure that we have the right policy interventions that flow from that. And to begin that work, we for example, have got this £1 million fund with the innovation pilots. Over the course of the coming months, we'll be able to say more about how that work is going, following thorough evaluation. But again, what we're concentrating on with that is what is scalable and what is helpful to businesses. And then aside from that, we've got interventions like the rolling out of individual placement and support in primary care as a pioneer for universal support, very much focusing on working with someone to understand what their capabilities are, what their aspirations are, trying to help them find the role that is right for them, to support them into that role, and to then help them to retain it. That is an established model, and it's right that we were able to get started with universal support by rolling more of that out, as well as the place and train support that we had go live a couple of weeks ago, that again builds us up towards those 50,000 places that we committed to in the economic announcement that the Chancellor made. Initiatives like Workwell partnerships will play a part in this as well, and we need to have a complementary offer here to existing health landscapes. And what we will do is we will work with local integrated care systems to make sure that we have a complementary offer, building greater capacity, building greater resilience, and that'll be different from area to area depending on what the needs are and what different health landscapes look like. That will be done very much in partnership on a local level, and I'm excited about the opportunities that presents. Things like employment advice in NHS talking therapies, working with people at the right time in that talking therapies journey to explore employment opportunities, or where someone is in employment, working with them to understand what their needs might be and how reasonable adjustments could be made to support their retention within work. Again, very positive. On the point that we made earlier about knowing what good looks like. The information and advice service that we've launched responds to some of that. There are steps still to be taken. We need to iterate that. We always need to respond to what businesses and what employers would find helpful. But that is a genuine effort to try and bring a greater body of helpful advice and support all together in one place, rather than people having to look at many and varied sources to get the information that they need. And I couldn't be clearer that one of the most important things we need to focus on is how we improve know-how, how we improve knowledge, how we improve confidence amongst employers to have meaningful workplace conversations, to understand what people's needs are, to understand what reasonable adjustments they might require to support their ongoing employment. And of course, we've also got ongoing at the moment the work capability assessment consultation that is looking at the work capability assessment. It hasn't been reviewed since 2011, so we're looking afresh at some of the aspects of the work capability assessment in the modern environment, where we've now got a greater abundance of home working, we've got a greater abundance of flexible working in a way that we could never have envisaged prior to the pandemic. That is now widely used in many workplaces. Many people see that as being beneficial to them, and we think it's right that we have another look at the work capability assessment to see whether we are doing as much as we possibly can to work to provide work opportunities and to open up work opportunities for greater numbers of people. But again, it comes back to opportunities around retention, and it won't be right for everyone, but for some people it will be the right approach. And it may be the difference between being able to do some work or not being able to do any work. And bearing in mind that we have this 1 in 5 disabled people who want to work with the right support, it's right that we thoroughly have a look at this. So, as I say, just to conclude, there is a huge government join-up in terms of energy, enthusiasm and determination around this mission. We think that we can do better to support more disabled people and people with health conditions into work, as well as working in partnership around retention. And I do get a little bit frustrated sometimes in the media reporting that there's a great focus on job starts, not necessarily enough about retention, and we need to talk about those two things in equal measure. But what this government is about is not writing people off. The structural reform lends itself to that. It will take some time to get there, but we want to get on and deliver what we can deliver ahead of that primary legislation in the next Parliament. But overall, there needs to be a joined-up, holistic approach to this, helping people to retain work and making sure that we better equip employers to play their part in helping people to do that.
Super. Thank you very much.
Yeah, I thought it might be helpful after sort of that discussion what the government is doing to perhaps take a sort of longer view of the context here and the sort of political and structural incentives that's got us into the position that we find. If you look back over the last 30 years, there's been just a huge rise in the number of people who are claiming incapacity benefits, from 600,000 to more than 2.5 million people off long-term sick now. And I think the drivers of this, they're varied, perhaps not fully understood. Some of it is to do with a sicker population, but others are to do with how we define things and the incentives in the system. For example, young people now are twice as likely to be claiming disability benefits as they were 20 years ago due to a huge rise in mental health conditions and diagnoses, which to the extent those two things are different. And one of the things I think we have perhaps not yet resolved, either in government or society, is to what degree we think prevention is essential here as opposed to just treatment, and what certainly workplaces have in either of those. And I think one of the reasons we've seen this sort of big rise in the big change in the benefit system is sort of political incentives. If you go back to the John Major years, the New Labour period, the incentive was unemployment. Anything that made unemployment look lower was welcomed, even if that meant sort of shifting people off onto other aspects of the benefit system and sort of not talking about them as much. And then sort of 10 years ago, you had the shift to universal credit and simultaneously a desire to save money from the welfare system, particularly of those people who were deemed capable of work, and that has created a big financial discrepancy between people on universal credit who are looking deemed capable and told to look for a job, and those who are ill, and that is effectively a very big financial incentives to be ill, and that inevitably has an impact on how people behave and how they see themselves. And I think the system is perhaps waking up to that now. And in this, in the last year or two, we have now had a very different political incentive when we have high inflation, a desire to get that down through lower pay rise. We have record numbers of vacancies in the economy, desire to fill those, and of course a desire to find tax cuts and to fund that essentially by not spending so much on welfare. And all of those three things now align to make this a much more central political imperative than it perhaps has been for decades. And you see that in the announcement the Chancellor is making today, and what is being trailed about his desire to get benefit payments down. The details of that still seem a little bit fuzzy, but you see the importance of it here. But of course, in the system, both within government and outside, again, the incentives to do this, I don't think quite align at the moment. I mean, particularly when it comes to workplaces, I don't think many people would praise the US healthcare system for very much. But one of the things that Simon Stevens, who was head of the NHS, used to say was the fact that employers in America were on the hook for healthcare costs did give them quite a strong incentive to keep their staff healthy. And there really has been nothing comparable in this country. And within Whitehall, you have the DWP effectively picking up the bill for decisions made by the NHS, and a sense that actually that is not taken account of in the health service. They're not thinking about these decisions, and people have suggested things like, should the health service get a share of any savings in the benefit system through getting people back to work? And be interested in thoughts on that. And the Minister mentioned work well, and it will be very interesting to see what a health scheme essentially run by the benefit system does differently to what the NHS does. There's clearly an opportunity there to be better aligned with workplaces, but we don't know quite what that will look like in practice. And the other thing that obviously the government is looking at, which is interesting in this area, is tax breaks for occupational health. And again, we don't know what the scale of this will be. Will it sort of be slightly tinkering, raising the cash limit for how much you can claim against tax? Will it be something more dramatic, like a super deduction scheme for any occupational health spend to be set against tax? And will it think about prevention? So should we, for example, employers be subsidised to get their staff to exercise as well as to take up physiotherapy? I think these questions have not yet been answered, and some of these touch on quite sort of difficult social questions about where the balance lies between individuals and state and employer. But I think it's good that we're talking about this. And also the occupational health, there used to be sort of fit for work service nationally, which could have been a national occupational health service, didn't seem to work. And there were discussions about, do we need something like that back again? I'd be interested to hear the Minister's view on this. And I suppose finally I would say, in terms of the politics of this, what the government is trying to do is quite ambitious and is far-reaching. And obviously there's not long until the election, but it is interesting that what Labour are proposing is pretty similar to what the government is trying to do. They're worried about the same problems. They're looking at quite a lot of the same sort of solutions. They differ in some aspects. But, John Ashworth, who was the shadow working pension secretary quite recently, I remember challenging him, what do you actually disagree with the government on? And his main thing was, well, we thought of it first. No. So actually there is quite, I think, potential for some long-term work in this area, whoever wins the next election, to try and get on top of this. And there's an unusual degree of political consensus on this.
Super. Many thanks, Chris. Alex.
Thank you very much. I represent the British Chambers of Commerce, working for the Chamber Network across the UK. And I think our contribution to this debate probably starts from the point of view of employers, businesses who are actually doing well and want to grow and need people to run their businesses more efficiently, or perhaps to increase their turnover, and are frustrated in doing that. So people skills shortages comes up time and again in our surveys. I'll give you one example from May this year. About 1,300 respondents, 73% said they had a shortage of staff. But what was interesting to me for this session was that 3/4 of those people said that this was actually adding to workload or reduce productivity. And so I think if I can just extrapolate a bit, what seems to be happening is the shortage of people is just making work less enjoyable, more stressful for the people that are in the business, or they're just doing less stuff. So that's kind of our starting point. So in regards to occupational health and the role of business, look, we are working hard to respond to the consultations that are currently out and close very soon. Here's some emerging conclusions from our side. So We think that being in work, being in rewarding, productive, fulfilling work is good for people. We also think that it's important to intervene quickly, if possible, because the longer somebody is out of work, the more difficult it appears to be to come back. And the shared interest here is very clearly between businesses needing people and people actually being more healthy when they are working, assuming it is good quality, not dangerous work. So where are employers now? I think it's as the Minister said, the role of flexibility in work has totally changed. It's particularly since the pandemic. Everybody here knows that. Our survey showed that about 3/4 of firms say they're offering some sort of flexibility, although that is lower, obviously, for manufacturing and other firms where you just have, by its nature of the employment, that's more difficult. But I think it's really important for employers to have confidence, to have conversations with their people about health, about well-being, and there is some element to this of management training, not saying it has to be government provided, but just so that employers are able to actually have those mature conversations with their people where they perceive there may be a health or well-being issue. With regard to the big questions really in the consultations about tax incentives, standards and support and so on, the using the tax system is appealing in the sense that it can be quite an efficient way for business to influence business behaviour. Definitely wouldn't say no to advice and support, but we all know this, grant schemes, subsidies of various kinds do tend to come and go a little bit. And also there is the faffery, to use a technical term, involved in applying for these things. So we are actually quite keen, and we've asked for it in two budget reviews in a row on increasing the cash allowance, actually. It's just one idea of the amount that can be offset against tax per person per year could be raised to offer more of an incentive to business to act. A couple of other final things. We run an expert panel of employment lawyers and HR professionals to give us some more detailed advice. Their take on occupational health is that it's better if the provider knows the business well. Larger firms, they may be able to have an in-house provision, so they know the type of work, know the people. That seems to be good practice. That's clearly not possible for all businesses, and particularly SMEs in many cases, who, as we've heard already, have a proportionally lower provision of occupational health than large businesses. And finally, just reading the research around this, we do appreciate that where other countries have regulated for it, you consequently have higher provision. I think it's 75% coverage according to the consultation documents. We are, I think, more in favour as a starting point of standards, of guidance. We put a pretty high bar on regulation. To us, it just needs to show it's more efficient and would not impose overdue costs that are unsustainable for business. So we would, I think, support the guide, advice, standards, good practice approach, and we're very interested in the tax incentives as well. So I think I'll leave it there. I hope that gives a perspective where we're coming from.
Super. Many thanks, Alex and Jay.
Great, thank you. So I think, there's such a lot in this topic, really, and I think, it's not something that's going to be going away. So at the Health Foundation, we've been doing analysis on future projections of health in 2040. And what we're facing is not just a population where the burden of ill health is growing, but we've also, as we know, got an ageing population. And what that means is by 2040, the number of people living with a major condition is going to grow by 37%, whereas the working age population is going to grow by 4%. What that actually means, they're slightly different population sizes, so it's not kind of quite like-for-like comparison, but what that potentially means is that by 2040, everybody new coming into the labour market is going to have to be working in the health and care sector. Now, I don't think that's what most employers are going to want to be faced with. So we've really got to be standing back and asking this question, what are we going to do to help people stay healthier for longer? So I think what I observe is it's really good. I think that employers and businesses are really starting to recognise that health is something that they need to be thinking about, their workforce health. But I think they can't think about it sort of in isolation. We need that bigger picture. And the way we think about it is what can employers do to help people who are out of work on health grounds get back into the workplace. And there's 2.6 million people currently out of work on health grounds in the UK, 1.5 times the population of Greater Manchester. So it's a huge number of people. And while I think, there's certainly, we kind of know financial incentives do change behaviour, but actually the poor health in the UK, we are out of step with sort of European neighbours. And in fact, one of the things we're highlighting today at the conference is that in the 1950s, the UK had the longest life expectancy in the G7. Now the life expectancy in the UK is the second lowest. Only the US is lower than us. So we know we have a health problem in the UK, and we need to do something about it. So yes, we need to help the people who have poor health get back into work, and there's lots of policy being consulted on at the moment and schemes that are in place both locally and across businesses that we know make a difference. The other thing is how we help people stay in work for longer when they have health conditions. And that's also recognising the changing nature of poor health. So in the past, it was always musculoskeletal disease that was kind of up there in terms of one of the biggest drivers of absenteeism. Now it's mental health. So we have to be thinking differently about those needs. But I think the third question is how do employers, businesses think about the way in which they can help contribute towards keeping a population healthy? And that's about the terms and conditions that they offer. It's about making sure people have a living wage. It's making sure that people have control over their work life, things that minimise stress at work. We also know it's about looking at the products and services that that businesses are providing. So, kind of, it's a bit of an irony if you're a employer, a business that is kind of essentially making your money through producing products that are ultimately eroding the health fabric of the wider society. And we have to start thinking about this. We have to start looking at the challenge of child obesity, which is obviously driven by our food environment, and so on. So there's something very important about products and services and businesses really thinking about what they're doing. And we've seen a lot of the supermarkets really change the way they think about how they're promoting food products, because they understand that connection between what they're selling and the health of their future workforce. And then the third thing is the role that businesses can have in the community and the way in which they can be supporting and doing this kind of outreach. So the sort of anchor institution businesses that have the ability to invest in things like occupational health, how do they start thinking about what they're doing with their supply chain and how they're helping smaller organisations in their supply chain actually access some of those benefits? So I think this is a subject that really is going to be on the agenda for some time. It's not going away. I think it's really great that businesses and employers are thinking about it, and of course they will, because they're at the sharp end of the shortages that we've heard about. But actually what we really need is government to be looking across all its policies and making sure that what they're doing is lining up and putting health heart and centre at those policies.
Lovely, many thanks, Jay. So yeah, a huge amount to get our teeth into, and really I just wanted to give the minister the opportunity to respond to any of those comments. I mean, some of the points that Chris is making around the wider politics of this, the differentiated offer that the government will have to the opposition, I think is an interesting question. There's a fascinating question about, you set out a case for more personalised services, particularly on that point around retention, which I think is really interesting. And that question around to what extent that principle also can be applied to workplaces, or whether we do need a little bit more of a, maybe not one size fits all, but more sort of standardisation in the expectations around business. So, but happy for you to comment sort of on any of the points that stand out.
Yes, I think you sort of summarised the key things that I would really want to touch on there. For me, the opposition's position on this is not clear. I am not clear about whether the Labour Party would adopt in their manifesto our structural reform. I am really clear that there is a strong case for the structural reform that we are seeking to advance, and obviously our commitment is a very clear one, that we would legislate in a new parliament to deliver that structural reform. removing that jeopardy that people feel around wanting to try work but then stepping back from that because of the fear of perhaps even identifying a role, getting close to taking that role, but then the fear factor of trying it not working out, losing their benefit entitlement and then having to reapply and be reassessed just gets in the way. And to me, we've been through extensive consultation around that change. I think it is the best route forward in terms of alleviating that pressure, removing that anxiety that people feel. And I hope that with Liz Kendall now as the Shadow Secretary of State, she will have another look at that and be clear about what the Labour Party's intentions are, because it is an important change and it's one that needs to be made. And I would love to see a situation where, with cross-party support, that legislation can be taken through Parliament, because the ethos behind it is right. I think the mechanism is right, and it's been through very thorough consultation. And what we're now doing is working that structural reform up in an inclusive way, with lots of engagement and workshopping to make sure that we get it right. And I want that to be a process that disabled people and their representative bodies are a part of as we shape it, and hope that we'll have that cross-party back in to do that, because it's the right thing to do. And the more conversations I have with disabled people who want to try work and just step back from it because of those concerns convinces me that we're on the right track. I think your point about tailoring as well is a really apt one, because everything that we are doing is concentrating more on what people can do rather than what they can't. That is the direction of travel that underpins our reform agenda. And inevitably that speaks to a need to have greater tailoring within the system to make sure that we are understanding what people's needs are, making sure that we understand what people's aspirations are, and then helping to find a role that is right for them and to then retain it. And when you think about universal support, that is principally all about working with someone in that intensive way to then find the role that's right for them, working with them and then support them into it. And actually, when you look at some of the data around the sort of early efforts with individual placement and support in primary care, which we've used as the pioneer, it speaks to the sort of success that there has been around that, and that's why we are committed to delivering that as the early phase of universal support. And I also just think that, you know, when you look at things like access to work, I didn't touch on access to work in my earlier remarks, but it has been very successful in supporting a considerable number of disabled people into work and to sustain work and to provide the support around people making those work opportunities a success. But I also think that there is a piece to look at in further detail about what we can do to support more widely greater awareness amongst employers about the sorts of reasonable adjustments that they can make to try and aid people's retention within roles. I think when we move forward with the Disability Confident Review, I think there is a trusted brand there that actually is a good umbrella to be able to provide greater resourcing. That information and advice service that we've rolled out, again, this is an early effort in that journey. We need to find out and we need to hear more about what would be helpful, and I think the consultations will feed into what information employers would find would be of benefit to them moving forward to have hosted on that information and advice service, so they can get all of the right information in one place rather than having to visit lots of sporadic different sites. But to me, awareness around reasonable adjustments is a really important part of this, but just that general focus on making sure that everything that we are doing is being done in a joined-up way, and in a way that I think you sort of explained really eloquently. That's precisely the work that's going on between ministers in the DWP and health in particular, looking at everything we do through the prism of having joined-up responses to the challenges that people face, but also recognising that for many, many people, work is a determinant of better health outcomes, and that is an important part of the journey, hence why things like the talking therapist services, we are getting to a point where 100% of those services in England will have that employment dimension built into them and available to people who want to access that.
Thank you. I was really struck by your comments, Chris, on sort of both the wider politics of this, but also potentially the sort of changing, almost philosophical approach that we've got to this question. I wondered if you felt that it was sort of an inevitability, actually, that the expectation was going to be for employers to have a much bigger role, and indeed that the state effectively is going to, maybe if not mandate, but is going to step in much more to provide that sort of positioning on where employers need to.
I don't think that is the logic of what the government is trying to do, but I think there are things that get in the way of of that. In one sense, it is much easier to talk about the structure of the benefit system of the government than to talk about employers, because obviously, as ministers, you don't want to lecture employers, but also it does get to these points about, well, actually, what do we expect of employers? Also, well, what can employers reasonably expect of their staff? And I think that is a wider social question, which I think we haven't found the answer to, and that goes back to some of the points that Joe was making about, well, we are just an unhealthier society than we were. We really do need to do something about that, but how does that change? Ministers, for understandable reasons, don't want to be seen as finger wagging and saying you've all got to, get off your backside, start doing exercise and eat better, because that doesn't go down very well and probably isn't very effective. But ultimately, if some of these things are going to make a big difference, that has got to involve people changing the way they live their lives. Probably that will involve some kind of incentive of some kind or another from their employer, at least being part of that. So I think we are, once you open this, you are into a much bigger conversation. I think we're only at the start of, and the reforms and structures of benefits, I think, is one aspect of it. But that bigger element, I think, is probably only just beginning.
That's very helpful. And a question, actually, I suppose, in some ways I want to put to both Alex and Joe, which is that I think there is sort of consensus on the panel that there is the direction of travel is expecting workplaces to do more, and that there's a lot of good things that have been set out by the minister. But perhaps a provocation for me would be that what's happening is necessary. The question is whether what is there will be sufficient. I suppose what I'm getting at is thinking about your comments, Joe, about sort of the preventative piece here is so significant, thinking about the longer term sort of burden of illness there will be. And for instance, in the consultation, things like tax incentives to incentivise exercise or running isn't included as suggested, but things like flu vaccinations are. From your perspective, do you think there does need to be that much wider expansion, sort of enablement business to be able to offer those services?
Yeah, I mean, I think what we've got to start thinking about is recognising that health is a product of all aspects of our lives. So, we do tend to think about, vaccinations and so on being important interventions, but there are other ones, as you say, about supporting people to be more active, thinking about the food availability and so on. But I think we've got to avoid this being something that is seen to be sort of entirely solved in the workplace, because the workplace is just a microcosm of the sort of wider society that we're living in. And one of the risks of too much of this being channeled through the workplace is that it kind of relies on individuals with that sort of, the commitment, the get up and go, the agency to do something about some of these things. And the risk is that just kind of widens inequalities, because what we know is the way people live their lives are shaped by the opportunities that they have. So if they're not having the opportunity to access, nice parks, places to go for walks, if they're living in places where there's high air pollution and their asthma is exacerbated, if they're living in housing that is cold and damp and there's more mold and they're going to be more subject to respiratory conditions, these are all things that are outside of the workplace. So I think this is why we kind of got to keep going back. It's a start to start thinking about the things that we can do for individuals, but actually this is such an endemic problem that we've got to be thinking about these wider building blocks of good health, and actually how, as a government, it really takes this investment in prevention seriously.
Thank you, Joe. And Alex, do you have any reflections on comments in the media?
Yeah, thank you. And I feel like this is the emerging thing for me is it's always a tricky one to sort of present as the voice of all businesses, right? So I just sort of take this for what it is. The impression that we get is that there's much more willingness in the business community to actually engage with this stuff. We do see occupational health. There's some great private sector initiatives, fantastic companies doing occupational health, and that's good. That's a good thing. Given the shortage of people that I very briefly sketched out before, there's a massive shared interest here between people and employers to act, to intervene. So I think think of the workplace as one of the touch points where some of these interventions can land. And I just think employers need to be confident to start having these conversations. They need to incentives, not handouts, but incentives to offer occupational health. And there's a supply side element where great companies that exist already are providing services that are accessible for the smaller businesses as well as the large businesses. But of course, that is no substitute for the whole macro stuff that Joe knows far better than me, and the entirety of the sort of health issues won't be solved by a business. I think it's things have really moved on since we left the EU, quite frankly, and during COVID, where business seems up for this in a way perhaps might not have been 10 years ago.
Thank you, Alex. So, well, it's your turn. It's over to you. So if you have a question you'd like to put to our panel, please raise your hand, and we'll try to come to as many of you as possible. So perhaps if we go to this lady in the third row, just to begin with, please state your name and organisation.
Oh, perfect. My name's Rebecca. I'm from the Association of British Insurers, and I'd like to know the panel's views on reforms to statutory sick pay. It could be a much more useful tool for putting an emphasis on employers keeping their workforce healthy and aiding in encouraging them to offer preventative measures for their employees. We've seen in other countries that where statutory sick pay is increased and there's an onus on the employer to provide it for longer, that they have then put in place better occupational health, which has a benefit for their employees as well, and also leads to much higher rates of that being offered across the whole of the workforce as well, not just like managerial positions. And it enables them to invest in things like traditional OH, but also vocational rehabilitation, and of course health and income protection insurance as well, which offer a much greater suite of measures.
Lovely. Thank you very much for your question. I wonder if I could put that to the Minister first of all.
Yes, I mean, obviously the sort of position from government at the moment is that we haven't got any proposals to reform the statutory sick pay system. But I suspect that with the consultations that are ongoing at the moment, this may be something that people will comment on in their responses. And it is, of course, an area that comes up in a number of the conversations that I have, and particularly when people are talking about things like phased returns, trying to be more innovative around how SSP could support that. So, you know, there aren't any plans at the moment in terms of taking forward any concrete actions on SSP, but I suspect that when we come to evaluate the consultation, that these will be things that people will have fed in. And, you know, I'd certainly encourage people in a really thorough way to make their views known in all of the aspects that are relevant to these consultations that we've got going on at the moment, because we are open-minded. And, you know, we want to see what people think and what people would deem to be helpful within that kind of wider support that we're seeking to take forward.
Thank you. Would anyone else like to come in on that question? Did you want to come in on that, Jay?
Well, I mean, you know, simply like, yes, you know, we do need to see better statutory sick pay in this country, and it is an area where we're an outlier with sort of European neighbours and so on. And I think this really speaks to one of the things about what we know about how the strain of living in sort of financial insecurity, we actually do know it kind of physically affects your body, you know, and that constant stress and worry, you know, adds to the burden of ill health. So this is something that, you know, people are already, if they're off ill, if we're layering on that sort of additional worry about financial insecurity, we're not helping them get better and get back to work.
Thank you. Perhaps we'll take another question, and then I'll give you both an opportunity to bring it. So perhaps if we just go to this gentleman here. Just one moment while the mic comes to you. Please state your name and organisation.
Thank you. It's John Pring from Disability News Service. Research by public health experts from Liverpool and Oxford universities concluded in 2015 that the government's programme to reassess people on incapacity benefit through the work capability assessment between 2010 and 2013 was linked to about 600 suicides in just 3 years. There have been countless other deaths linked to the WCA, including by coroners, the Mental Welfare Commission for Scotland, and the department's own internal reviews. Particularly for the Minister here, are you aware of that research, and will it affect how you approach your latest reforms, the latest ones, not the white paper ones, that will tighten the work capability assessment?
Thank you for your question.
So to respond very specifically on the work capability assessment, the government's very clear and stated position is that long term we want to scrap the work capability assessment. I well remember many debates in Parliament, actually before my time, where there was a lot of argument about the work capability assessment. We think the right approach is to reduce the assessment burden, so we will have one gateway into the new system, which will be the PIP assessment. At the moment, you will appreciate, John, that we have got an ongoing consultation in relation to the work capability assessment and a number of the descriptors within it. We will, of course, proceed with great care, as you would expect, with any reforms that we may seek to take forward on the back of that consultation. I'm not going to preempt what the outcome of that consultation is. It's right that we have a proper process and that people are able to contribute their views and their insights, and we will take a view based on the evaluation from that. But you can be absolutely assured that one thing at the very forefront of my mind is that, you know, we are often engaging with people who do have very real vulnerabilities, and they must be always treated with respect and with care. And all of the changes that we've introduced in recent years around safeguarding, I think have been a positive step forward in the period since 2018. I am continuing to engage with relevant stakeholders around those processes to make sure that they are as thorough as possible, to make sure that we are making every effort possible where, for example, someone has a particular vulnerability or particular needs, that there is all of the right safeguarding around that, and that people are signposted to the support that they need. And so I can absolutely say to you that we will take forward any reform that we seek to make as a government with the utmost care and attention to the needs of our most vulnerable customers.
Are you aware of that research?
I consider a wide range of matters when it comes to these vulnerabilities that it's right that we are responsive to. There has been considerable work taken place since 2018, particularly tangible improvements that have been recognised as being quite significant strides forward in terms of those safeguarding mechanisms and the approach. But we continue, of course, to keep that under review, taking account of all reports and all recommendations that are made to us.
So would either Chris, Chris or Alex, would you like the opportunity to respond to either of those two questions on statutory sick pay or the gentleman's question?
Yeah, the nice easy ones, aren't they?
Indeed.
Well, look, I think if we, I know I'm slightly ducking the question, I suppose, on statutory sick pay. It's as you can imagine, an employee representative body. It's something we've got to check with the members and everything. But I think the point about what could incentivise business to offer more occupational health services, that is what we are also wrestling with. So, in the words of Paul Krugman, people respond to incentives. So if that's what we want, is we want an incentive program. So, but the statutory sick pay, national living wage, these are things we work on in a quite formal way actually, and put very considered submissions in. So I won't sort of opine on that. And similarly, it's very, obviously very sensitive issue around workplace assessments, etc. I'm not a specialist in that. But what I would say, talking to my team before this event, was really, we're keen to stress that employers want to see people who are willing and able and wanting to work. Whatever the scheme ends up being, that balance is really for government to do. But they just want to be confident that people are coming back to work and want to be there and are fully capable of doing that job in a safe and responsible way.
Thank you. Chris, did you want to comment on any of those points?
All I would say is, from a government's point of view at the moment, you could certainly see the attraction of only policy that tells someone else to spend money rather than spending money themselves. You've seen that with the National Living Wage announcement today, and it is probably easier to make that argument to government that they should do something and sort of basically tell businesses to spend more. I think is it's something that is easier, I think, to get past the jury.
Thank you. Do we have any other questions? Perhaps if we go to this gentleman in the second row at the edge, and then we'll try and squeeze in a couple of other questions.
Hello. Yeah. Hi.
Name and organisation, please.
Keir Gallagher, Cycling UK. So you touched earlier, Joe, on how there's lots that can be done in the workplace, but a huge amount out of that. There is an overlap there in the commute, and you're sort of reaching into people's lives. Now I think something like people who are regularly active, I think, take 27% less sick days. And I think we do see a lot of organisations recognising if they can encourage people to be active and use cycling and walking as part of their daily life, then that can actually have a huge reduction in the number of sick days. So I guess the question really is how... DWP, Health and Department for Transport and businesses can work together to convince Treasury that more money needs to go into this, so that we can get people travelling to and from work using cycling and walking.
Thank you for your question. We're a little bit tight on time, actually, so I might just pick out another question. There's a gentleman, I think, over here who wanted to ask a question, so if you could quickly run around, my colleague. Who was it that had their hand up? Yeah, if we go for this gentleman just in the middle. Name and organisation, please.
Hi, Alfred Slade from the Obesity Health Alliance. Just to pick up on the points earlier around obesity and food products, in the discussions we've had, particularly around the government's obesity strategy last year and the delays to those policies, it was very much framed as public health versus business. And none of these points around the economic impact of a relatively small number of mostly American multinationals making vast profits from products that harm people's health, the way that the government and the wider business community is picking up the tab for that via 4 extra sick days for every person who is living with excess weight, via the increased welfare costs, via the poorer economic productivity. That was not part of that discussion. When those policies were delayed, it was entirely framed as business on one side and public health on the other. How do we bring this conversation into that space so that we can have a more honest and accurate reflection of the role of public health in improving economic productivity?
Thank you for your question. Just because we're relatively short on time, perhaps I could go to the Minister first, offer final reflections on sort of any of the points that have been raised. Anything further you want to add?
Well, I mean, just to answer those sort of 2 points very directly, I mean, as someone who is a keen gym goer and a runner, I absolutely see huge benefit to people making healthy lifestyle choices, and I would certainly be very keen to have a conversation with you about what more you think that we could be doing to consider that. And it sort of speaks directly actually to one of the great things about my role is the sort of cross-government nature of it, in terms of working with other ministers in other departments, chairing the Ministerial Disability Champions, to make sure that when we're considering disability, we are doing that in a joined-up cross-government way. And actually the Minister for Maria Caulfield, one of the ministers in the Department of Health, is the Ministerial Disability Champion representing the Department of Health and Social Care as part of those cross-government efforts. And I know that these are areas that they continue to look at in health around those lifestyle choices. And I'm sure that if there's any insights that you've got around that in particular, that ministers there would be very willing to consider them.
Many thanks. And perhaps if we could sort of make our way along the road until we give Joe the final word. I wonder, Alex, if you had any final reflections.
Well, thank you. I love the question about cycling. I was a trustee at Living Street, so walking for 5 years, and I was vice chair there, and so I used to work in active travel as well. So yeah, I think, I don't have the stats in my head, but the cycling to work scheme is a fantastic benefit. I'm sure loads of people here in the conference have used that. I think that kind of policy is really smart, because it's a way business can actually incentivise certain behaviours in a low stress, affordable way. So, but obviously we don't control town planning, right? But and I'm absolutely confident to say the healthier the workforce, the better. And if business can play a role in that, then all credit to them. And also providing cycle parking facilities and showers, if to the extent that's possible. That's happening more in my experience, and is a really good thing. So I think that is the kind of cooperation between business and your communities that we should do more of, quite frankly. Yeah.
Thank you, Alex. Chris.
Yeah, I suppose on the sort of idea of those spend to sort of saves schemes, the idea of investment up front can pay returns down the line. I mean, the Treasury's always hated them. It always says the spending is certain, the saving is very uncertain. But I actually think the DWP has been quite good in this area in terms of the work that's gone on in trying to convince the OBR, particularly the individual placement support schemes, the precursor to universal support, the pilots of those, to show actually these do actually save both the Treasury money and will boost the economy, and building the evidence of that. And the ABR clearly responded to that in the budget. We probably expect some more in the autumn statement on that. And you can see the Department of Health learning from that in their approach to things like weight loss drugs and how they make the case to the Treasury in the OBR. So you do see a gradual shift to sort of saying, well, if there is evidence there that the OBR can sort of use to sort of make this less of a burden on the fiscal rules, that will be considered more, and anything that has evidence behind it is probably to be welcome.
And I think the key thing there as well is that it sort of links back into what we're trying to achieve with Work Well, recognising that in different areas, different interventions may be of help. So we should be looking in a really kind of wide-ranging way about what that complementary offer looks like. It is about trying to build kind of greater resilience alongside health systems. You know, when you consider that sort of resolving some of these challenges around work loss and sickness-related work loss or inactivity has a quite significant reduction in terms of GP capacity issues and people going on to need to spend time with their GP, etc. So we ought to be looking in a really thoroughgoing way about different interventions, and I think there's quite a lot of opportunity within Workwell to really explore what works in different areas, building that additional resilience and capacity alongside existing services, and I think we could look at some quite innovative ideas come forward as part of that.
Definitely. Many thanks. And Joe, over to you.
Yeah, so I think I just finished by reflecting. I think the conversation is really changing on this. So 5 years ago, I don't think there would have been a group of people sat in this room talking about employment and health, but we're starting to see that actually the eroding health fabric of the nation is starting to affect our productivity and our business, and it's on the agenda now, and I think it's only going to continue to be on the agenda. So I hope kind of over the next few years what we'll start to see is a real sense that people have to focus on both the sort of individual workplace policies that can make a difference to people's health, but also some of those wider government policies to make sure everybody has the best start in life.
Many thanks. Well, thank you very much to everybody. I apologise for those of you who had your hands up and waited patiently. I wasn't able to come to you, but this is very much an ongoing conversation, as Joe sort of reflected at the end there. The debate has moved on very quickly over the last few years, and indeed will continue to do so. And eagerly anticipating the outcome from the consultation and where the government goes next. So just to say a huge thanks to the Health Foundation for their support of this Fringe event, and I hope that you'll join me in thanking our fantastic panels. Thank you.